Respected audience, this is Naushabe Khan, attorney at law, adjunct professor law. As a matter of fact, this series of programs we have prepared for yourself is basically based on my keynote speech, which I have recently delivered in a national medical conference known as FamilyCon. And the response I have received by the healthcare providers and healthcare establishments, and especially the doctors practicing in the field of surgery, practicing in the field of medicine, ortho, and other subspecialties, and especially those who are practicing in the field of telemedicine. They have inquired a number of questions, and keeping in view their interest, I have started this series, and step by step, we will share the pros and cons pertaining to the practice of medicine or surgery or other allied areas of medical practice in this channel. And we will definitely apprise our worthy audience that what are the enabling laws, and keeping in view the relevant laws, what steps they are required to take to make sure that their practice as a professional, as a healthcare service provider, and their establishment, whether it is a clinic, it is a hospital, is run under the relevant laws and is up to the mark as far as the regulators are concerned. And as we know, that in all the four provinces of Pakistan, we have healthcare commissions, and likewise, we have a federal regulator in Pakistan, that is Pakistan Medical and Dental Council. Today, in this session, I will highlight some of the key areas pertaining to the Healthcare Commission working in all the four provinces, and their, in fact, relevant legal provisions are one or the same. So I'll initially place reliance on Healthcare Commission Act 2010, and that is meant for the province of Punjab. So let's start our part 8 of this series, and let's talk about the relevant provisions which are relevant to practice or while practicing and while operating or while managing a healthcare service uh, under the umbrella of healthcare establishment, whether that is a clinic or that is a polyclinic or that is a hospital, or at any level, whether it is primary, secondary, or tertiary. This law or these provisions of law are relevant to all these healthcare establishments. So, this is Healthcare Commission Act 2010. And first of all, I would like to share with you the definition of medical negligence. And this law provides that medical negligence means a case where a patient sustains injury or dies as a result of improper treatment in a healthcare establishment, and in case of death, determined on the basis of medical autopsy report. So, this is very important that if on account of alleged medical negligence, a patient has sustained injury, and that is on account of gross medical negligence, which falls within the purview of criminal negligence, then of course the definition of medical negligence or the very act will fall within the mischief of this definition. And furthermore, if God forbid patient has died and the reason of death is the dereliction of duty, or that is breach of care which a doctor owes to his patient, in that case, of course, on account of the death, autopsy report will determine that whether the death is on account of known medical complications, or this is on account of the gross medical negligence by the healthcare service provider, or the healthcare establishment in question has inadequate means or inadequate arrangements which have resulted into the death of the patient. So we will further discuss the provisions of Healthcare Commission Act, and of course we will also share with the audience the relevant MSDS, which are known as minimum service delivery standards. So in next episode, we will further highlight the key areas to help healthcare service providers and healthcare establishments to work within the purview of law and to avoid any hardships. Have a blessed day.